Poverty is much more than not having enough money. The lack of financial resources leads to the inability to acquire basic needs such as food, water, and shelter. It prevents people from seeking proper medical help, securing a stable job, and having quality living conditions. As the World Bank Organization states, poverty is hunger, it is a lack of shelter, it is being sick and not being able to see a doctor. Poverty is not having access to a school and not knowing how to read. It is not having a job, it is fear for the future and living one day at a time. Simply put, poverty affects many different aspects of people's lives. This is because individuals cannot purchase their daily needs, forcing them to make substitutes or even foregoing necessities, creating negative impacts. When looking at the correlation between poverty and the health of individuals, it is clear that those living below the poverty line often have worse health compared to the rest of the population. Whether it is mental or physical health, poverty and poorer health often go hand in hand. Poverty negatively affects mental health because of the stress and anxiety that arises from having to figure out a way to make enough money to put food on the table or make rent. Thus, the necessities become extremely challenging and worrisome. Additionally, poverty negatively affects physical health because something as simple as fresh food becomes too expensive. As a result, substitutes must be made, such as buying frozen or processed foods, which are often much cheaper. However, processed food is much worse for your health because it is high in calories, filled with preservatives and fats, and lack nutrients and vitamins, all of which negatively affects physical health. When discussing the issue of poverty, we cannot overlook our current economy where unemployment rates are low, yet poverty has only risen. This is because a major contributor to poverty is the growing income inequality in our society, meaning, income is distributed unevenly within individuals of a population. It has become extremely common that those who work full-time are still unable to make ends meet. Therefore, with the rising income inequality gap, it has created a major concern for health outcomes since it prevents a certain group of people in the population from acquiring basic needs for a healthy life due to a lack of economic means. Being healthy requires resources, and for those that cannot afford it in this capitalist environment, they will not attain health. This is the breakdown of how to create a healthier society by the Insufficient Summary, a channel where we explore different ideas in our social world. To address health inequalities and promote a healthier society, Sir Michael Marmot's report Fair Society, Healthy Lives argues there is social gradient in health, and depending on the socio-economic position of an individual, it could positively or negatively influence health. In other words, social gradient describe the concept of social determinants of health, which refers to the social and economic conditions that influence health statuses of people, meaning, it is the non-medical factors that play a role in health. In general, the lower the social economic position of an individual, the worse the health. Therefore, health inequalities often stem from social inequalities. To fully explore social determinants of health, it requires an examination of a broad range of social and economic factors that determine individual and population health. Social determinants of health explains that policies and systems, including economic policies, development agendas, social policies, and political systems, all play a role in health. When suggesting change through policies and systems, Marmot argues that solely focusing on the most disadvantaged would not reduce health inequalities sufficiently. Rather, actions must be addressed through the entire population with intensity and scale proportionate to the level of disadvantage. By addressing health inequalities, it will in turn create economic benefits as it reduces strains and costs in the healthcare system. Furthermore, the state will reduce lost income from productivity loss and lower tax revenues simply by the population being healthier. However, to accomplish this, programs, policies, and resource distribution approaches must change at the population level. These interventions should be universal or targeted programs. The policies should be pro-poor, achieve policy coherence through different jurisdictions. Intervention should be aimed to change behavior and policy determinants, and it should be sustainable with the ability to scale, all of which creates the potential to influence health and health equity for the better. Then and only then will the interrelated conditions and factors that influence the health of the population over the life course improve. In the report, Marmot suggests that we should create 6 policy amendments with the goal of improving health for everyone in the population. The first policy is to give every child the best start in life. To do this, we must reduce inequalities in the early development of every child. We must nurture their physical and emotional health, and focus on improving their cognitive, linguistic, and social skills. Additionally, we must provide high-quality maternity services, parenting programs, childcare, and early year education to meet needs across the social gradient. To accomplish this, we must increase the proportion of expenditure allocated to the early years and ensure early years development is focused progressively across the social gradient. Also, we must provide support to families to achieve progressive improvements in social development, including pre- and postnatal interventions to reduce adverse outcomes of pregnancy and infancy. This includes paid parental leave with a minimum income for healthy living, providing routine support to families through parenting programs and children's centers, and developing programs for the transition to school, all of which leads to good quality early year education and childcare. The second policy is to enable all children, young people, and adults to maximize their capabilities and have control over their lives. To do this, we must reduce the social gradient in skills and qualifications. A good starting point is having schools, families, and communities work in partnership to reduce the inequities in health, well-being, and resilience of young people. Moreover, we must improve the access and use of quality lifelong learning across the social gradient and ensure that learning does not stop after finishing school. To accomplish this, ensuring that reducing social inequalities in students and educational outcomes is a sustained priority. Therefore, it is important to prioritize reducing social inequalities in life skills by extending the role of schools and what they teach to support families and communities. Additionally, it is essential to create a school-based workforce for students to build skills for the working environments and address social and emotional development to create resilience when they move into the working world. Lastly, education institutions should increase access and use of quality lifelong learning opportunities across the social gradient by providing support and advice on life skills, training, and employment opportunities. This includes but is not limited to work-based learning, including apprenticeships and an increased availability of non-vocational courses. The third policy is to create fair employment and good work for all. To do this, we must improve access to good jobs and reduce long-term unemployment across the social gradient by making it easier for people who are disadvantaged in the labor market to obtain and keep jobs. Therefore, there needs to be an improvement in the quality of jobs across all sectors in the labor market. To accomplish this, we must prioritize active labor market programs to achieve timely interventions to reduce long-term unemployment. Additionally, it is vital to encourage, incentivize, and enforce the implementation of measures to improve the quality of jobs across the social gradient by ensuring employers adhere to equality guidance and legislation. Additionally, it is vital for employers to introduce and implement stress management techniques and the effective promotion of well-being and physical and mental health at work. Furthermore, we must develop greater security and flexibility in employment by prioritizing greater versatility of retirement age, encouraging employers to create or adapt jobs that are suitable for lone parents, and create pathways in the careers of people battling with mental and physical health issues. The fourth policy is to ensure a healthy standard of living for all. To do this, it is important to establish a minimum income for healthy living. Therefore, we must provide a livable income and not a minimum income. This would reduce the social gradient in the standard of living. To accomplish this, we must develop and implement standards for a minimum income to provide for healthy living. This would require increasing wages for those making under a livable income and a progressive taxation program targeting high-income earners. By reviewing and implementing systems of taxation, benefits, pensions, tax credits, and other fiscal policies, it could provide a minimum income for healthy living standards and pathways for upward mobility for everyone in society. The fifth policy is to create and develop healthy and sustainable places and communities. To do this, we must develop common policies to reduce the scale and impact of health inequalities. Additionally, it is important to improve community capital and reduce social isolation across the social gradient. To accomplish this, we must prioritize policies and interventions that reduce health inequalities by improving the availability of good quality open and green spaces, improving the food environment in local areas, and improving energy efficiency of housing across the social gradient. By fully integrating the housing, environmental and health systems, it can improve the social determinants of health in each locality. The last policy is to strengthen the role and impact of ill health prevention. To do this, we must prioritize prevention and early detection of those conditions most strongly associated with health inequalities and increasing availability of long-term and sustainable funding in ill health prevention across the social gradient. To accomplish this, we must prioritize investments in ill health prevention and health promotion across government departments to reduce the social gradient. To add on, we must implement an evidence-based program of ill health preventative intervention by increasing and improving the scale and quality of medical drug availability and treatment programs to all. Not to mention, increasing the role of public health interventions such as smoking cessation programs and alcohol reduction programs, both of which are beneficial interventions related to the social determinants of health. There was a review of the report 10 years later to see if any progress has been made. Unfortunately, 10 years after the report was written, health inequality has widened as more people spend more time in poor health as compared to 10 years ago when the first report was published. Moreover, for the first time in more than 100 years, life expectancy has not increased, and for the poorest 10% of women, life expectancy has gone down. When identifying the problems of reducing health inequalities, the review highlights how wealth disparity is a major factor. As stated in the report, the more deprived the area, the shorter the life expectancy. Mortality rates have increased in so-called death by despair caused by drugs or suicide. Child poverty has increased. Children and youth centers have closed down more often. Education funding has gone down. A rise in housing crisis and homelessness, all resulting from the fact that people have insufficient money to live a healthy life. All of this to say, until pro-poor policy amendments across all jurisdictions have been made, it will be tough to see any improvement in population health in any meaningful way. If you found this video informative, please leave a like and subscribe to the channel. See you in the next video.